Hey, hello everyone, and welcome to yet another Tooth Talk with your dentist on thedentaire.com. I'm Dr. Rekha, and the Tooth Talk with your dentist is an initiative to increase oral and dental health awareness among people. Do visit our website www.thedentaire.com to get more information about your oral and dental health. Subscribe to our YouTube channel, and you can follow us on Facebook, Twitter, Instagram, and on Telegram. And in conversation with me today on the Tooth Talk, I have Dr. Shuaib. To give you a brief introduction about Dr. Shuaib, Dr. Shuaib did his graduation from the prestigious VS Dental College and Hospital, Bangalore. He pursued his post-graduation in conservative dentistry and endodontics from SDM, Dharwad. He has been a teacher, an academician, and a clinician with over 20 years of experience in the field of dentistry. He is a former HOD, Department of Endodontics, Rajarajeshwari Dental College, Bangalore. Dr. Shuaib has presented his papers on endodontics at various conferences across India. He is the recipient of the Best Paper Award at the National Endodontics Conference at Mumbai. He is also an opinion leader with Micromega Clotine, a French company for endodontic instruments. Currently, Dr. Shuaib is a consultant endodontist and has his own endodontic treatment center at Bangalore. Dr. Shuaib, very good morning to you, and thank you
Morning.
so much for joining me on this Two Talk conversation with your dentist.
Absolutely my pleasure. Morning to all.
Sure, sure. So doctor, you have been into clinical practice for more than 20 years now. So, in so many years of practice, in your experience, what do you think makes a patient come to a dentist? What makes them visit a dentist?
Well, to begin with, good morning all. To begin with, what brings a patient to a dentist? There's just one simple word to that. That's pain. Basically, it's a big PAIN. I mean, I've not seen in the last 20 years of my practice, I've not seen anybody coming in to just say a hi, hello, or just to check on if I was doing fine. Honestly, pain is what basically brings anyone to a dental center, and depends also, I think, on the acuteness or the severity of the pain. I mean, thanks to Google today and a lot of other platforms, there is a lot of self-medication. WhatsApp University is always there. So, there's a lot of self-medication which is taken place earlier. And when all that fails, that's when probably, they enter the dental clinic there. Yeah.
Understood. Yes, yes. So, doctor, I think generally patients could be a little confused between a tooth sensitivity and a tooth pain. So, do you think there is any difference between a tooth sensitivity and a tooth pain?
Yeah, see, Doc, when they enter a clinic, there are two responsibilities, if I may say so, as far as a dental clinician is concerned. A would be the diagnosis part of it on our part, and B would be educating the patient. I mean, letting alone all the universities, what we spoke of right now, educating the patient for the reason that, he has to know A, what the cause of his trouble is, and how best we could relieve it. So the cause of pain, like you said, could be just simple as dental sensitivity because of attrition or abrasion, wear out of his teeth for various reasons, him not brushing properly or his biting habits or his dietary habits. A. So the diagnosis would be important, and so would follow the correct treatment plan. B, it could be because of a fracture on his tooth or tooth decay, what has happened. And again, the diagnosis and the treatment plan follows. So for me, it's important that I diagnose and educate the patient equally well, so that he knows in his back of his mind what the cause is and what the treatment following up would be. That's as simple as that. So the first two important steps when he comes in with pain would be the diagnosis and the education part of it. The treatment plan will always follow in once you get the patient's consent.
So, Dr. Shoaib, some patients come to us telling that they have a sensitivity, means they have a sharp pain, they say, whenever they take something cold or whenever they take something hot. So, how are they supposed to, understand, the severity of the case
Yeah.
in such a
So,
scenario?
so this is very simple as far as patients go. For him to sit and understand at home, I mean, how bad his condition is. The simple part is here. The catch is here. If you go back to some of our textbooks, also, the simple part is if he's got sensitivity and which get or pain, which is very difficult for them to differentiate at home. So let's just keep it as pain or sensitivity when what he gets at home. If that's only sensitive to cold, to any cold stimulus, let it be ice cold water or aerated drinks or ice creams or whatever. So that is a condition which is repairable damage, I would call it as, where the nerve has not disintegrated. Basically, the pulp what we have inside the tooth, or the the nerve tissue inside the tooth, that's not disintegrate. So any abnormal, let me put it this way, any abnormal response to cold would be would probably mean just a filling or a restoration, or it could just mean as simple as using some of these desensitizing toothpaste. I mean, I'm not going to mention commercial names, but yes, toothpaste which reduce sensitivity. So as simple as that, I would probably tell them to use the desensitizing toothpaste, and we're done with it. Okay, so as simple as that. On the other hand, abnormal responses to very hot food or coffee or tea, which linger on for a long time, which probably is an indication. I say probably because there are certain diagnostic tests one would put them through. So it's probably an indication to show that the nerve inside has disintegrated, which may again end up with a root canal. Having said that, there are certain areas in the gray zone which the nerve is almost going towards getting non-vital or dead or disintegrated, as you may call it. So in that case, there are certain procedures to revive it back. There's something called where we protect the nerve with a filling material, a medicated filling material, and get the inflammation down, get the nerve back to good health, and the tooth continues to live, which
So
also eases the pain factor.
yes, yes. Dr. Shuaib, now I think RCT or root canal has become such a common term, and I think most of our patients today are aware that when they get a tooth pain, they will go to a dentist and he will do a root canal treatment for them. So, specifically, what do you think are the indications for a root canal? Like, in the sense, technically, when we do study about combined endo-perio problems or combined perio-endo problems. So, what specifically are the conditions that lead, a dentist to perform a root canal treatment for his patient?
Yeah, honestly, a lot of my patients, when they come in with pain, like you said, like I was just telling you, it could be the reversible type of pain, but a lot of them have been educated enough to say that every painful tooth leads to a root canal. I mean, that's what I do for a living, but root canals. But I don't think but the first step always is to avoid a root canal. Let me put it that way. For
Yes.
any tooth which comes in with pain, the first step would be to avoid a root canal. If that's not possible, if it's beyond repair as far as getting the nerve back to good health is concerned, then of course you have to end up with a root canal. As far as the endoperio, like a simple thing as far as food impaction between teeth is concerned. Now, some patient comes in with spaces between his teeth with a lot of food impaction. Now, let me tell you that that food impaction going deep into the gum area or the gingival area, pocket as we call it, that could be as severe as mimicking or imitating an abscess tooth. Yeah, and a patient has spoken to somebody on the phone and given his symptoms on phone, and here you are on the phone, the diagnosis done, saying yes, you need a root canal. But when they actually come down to the center and you relieve the food impaction and clear out and relieve the congestion, the pain is gone, and you avoid a root canal. Yeah, so it could be there. Or coming to the root canal part of it, yeah, olden days the root canals, the stigma still remains, honestly, as far as root canals are concerned. The moment I tell a patient today also that you need a root canal, the reaction is not so great. And I don't know about your practice, but 20 years I've not heard anybody telling me that they like dentists or like visiting a dentist. And root canals the prime villain, I think, there. So olden days root canals, using the hand instruments, what we were taught with, what I think, yeah, we were all in the same college. So what we were taught with had, say, about per canal, for each canal, you had about 18 instruments and about 63 steps for each instrument. Yeah, that's amalgamated now. It's got automated with the rotary instruments coming in, and we have almost a single instrument for each canal and finish it there. Yeah, so things have improved, and the visions as far as the magnification, what we look into the canal has improved with loops and microscopes. So the quality of treatment, of course, better anesthetics, thinner needles, a lot of things have improved, which have almost, I would say, 90 to 95% reduced the pain of having a root canal done. You
Yes.
the different type of anesthetics, etc. So those have become much more comfortable and easy as far as the patient is concerned. So I don't think the patient really should be worried about pain or troubles with root canal, and neither should be the clinician. Yeah.
Yeah. Dr. Shoaib, what do you think? Of course, the pain is, especially tooth pain, is something that's the most dreaded pain. I think everybody really, it's like a nightmare. And considering, the tooth pain always increases at night. So, what would you like to tell all our viewers? What are the preventive measures that somebody can take to avoid a tooth pain?
Well, there's an old saying, like a stitch in time, and that holds good for a lot of parts of our lives. But in simple terms, I think, we've been taught to tell patients, and of course, the patients also, all the companies, everybody says that visit your dentist every 4 to 6 months, which is good, I think, because, a normal consultation will not do any harm, but at the same time, it would probably predict any volcano erupting in the future. Let me put it that way. Yeah. So, in case it's simple as this, if you don't want to wake up midnight with any simple severe pain, it's good always to have that 4 to 6 months routine checkup, uh, and of course, brushing and flossing regularly, keeping those areas between, because those are the danger zones. Areas between teeth, contact areas, which are not generally looked upon well, and brushing and flossing regularly. A lot of people advocate the use of mouthwashes. I'm okay with it, but maybe once or twice a week, the non-alcoholic ones. And yeah, I think it's basic hygiene, what oral hygiene, what we need to educate again patients with, which should take them good.
Yes, yes. I think. End of the day, since we have all shifted so much into having refined food these days, there's no more fiber left in the food that we eat, and also,
Yeah,
food remaining sticky and remaining between the teeth.
that's
So
true.
those are
That's true, because a lot of the diet now consists of sticky sugars, especially with the aerated drinks and everything. So
yes,
yeah, those are your prime culprits, I would
culprits.
say. Yeah, yeah.
Yes, yes. So I think considering that, brushing and flossing becomes all the more important, and of course, visiting the dentists more often, just for a routine checkup. Probably we would just do a checkup X-ray if we have any doubts.
Yeah, check X-rays. X-rays, I would generally put them down to areas where, which are the doubtful areas, like you said. I don't have to take an X-ray just because the patient's walked in for a checkup, or
Yes,
have an OPG done or a full mouth X-ray done, just for the sake of a patient walking in.
yes,
And
yes,
yeah, the flossing sometimes I feel has been a little bit of a technique sensitive issue with some patients. So we
yes.
also have the simple interdental brushes which do the same job as a floss does, which are much more comfortable for patients to use. So I probably would advocate. I mean, I would go with that as well.
Yes. So, Dr. Shoaib, according to you, a regular checkup with their dentist and proper preventive measures at home to a great extent would help a
And
patient
diet, and
avoid.
diet, and diet. Most importantly,
And diet.
diet as well.
Yes, yes, of course, and diet. Yes. So I think these things put together, I think these are some factors that would help a patient, to prevent that kind of severe tooth pain that can happen. Because I think most of the time, between tooth decay is something that goes undetected for a long time. Patients can remain asymptomatic and without pain or sensation for quite some time, and by the time we detect it in our clinics, it would have actually gone to a stage of root canal treatment.
Or an extraction. So yeah, not having any pain is not really the criteria of not visiting a dentist.
Yes,
Um, yeah, as simple as that. So, and
yes,
also another reason for the senior citizens, particularly the diabetics, and of course now you see the diabetes with a much younger age group as well. So the diabetics particularly need to be careful with their teeth, because yeah, that the sugar levels do have an implications on the oral health, particularly on the gums. So I would put them under the regular group bracket where, every 3 to 4 months they need to visit for a general checkup as well.
yes, yes, yes. Dr. Shoaib, thank you so much. I think that was a very informative talk on tooth pain. Of course, the topic of tooth pain is such a vast subject, and I think we just spoke about only one aspect, which is the tooth decay part, and I think that also was such a general one.
Yeah, I think in our exams it was probably a 20-25 marks question, causes for tooth pain. So it was
Okay.
a big issue. It is a big issue all the time. Yeah.
Yes, yes. Since you are also an endodontist, Dr. Shoaib, I really hope I can get you back on this platform for another talk to share with our patients some more information about oral and dental health.
Will be a pleasure always, Anita.
But thank
Thanks.
you so much for joining in with me today.
Thanks so much, Dr. Eka.
Thank
Always a
you.
pleasure. Thanks.
Thank you. So viewers, that was Dr. Shuaib Razvi, who did share with us some causes about tooth pain. So if you have any doubts or queries, please do leave your comments in the comment section below and we will get back to you on that. If you'd like to contact Dr. Razvi, I have given his details in the description box below. To know more about your oral and dental health, do visit our website www.thedentaire.com. Do subscribe to our YouTube channel and you can follow us on Facebook, Twitter, Instagram, and on Telegram. So until next time that I come back with another dentist with another topic on your dental health, keep smiling and stay happy. Thank you.